What up, fellas? It's time. Welcome back to the channel where we discuss all things prostate and prostate cancer related. So today's topic is men don't like to go to the doctor. Now, this may or may not apply to you. I'm going to ask you in advance to watch as much as this as possible just so that the algorithm sends it to the person that this is meant to help. And the reason I want to discuss men don't like to go to the doctor is because I don't think it's true. I heard it this morning on an interview, and I was like, I've said that a couple of different times in videos that I've made, and then I thought about it, and I said, maybe I've heard it so much that I've now taken upon saying men don't like to go to the doctor. But the more I thought about it, I don't think that's true, right? So the men in our community have gone to the doctor. So it can't be that men in general don't like to go to the doctor. They like to make these slashing generalizations about men so that they don't really have to deal with the fact that they aren't all in for our care the way they're supposed to be. And now there are some difficulties with getting men to go to the doctor, but it's not because they don't want to go. I don't believe that men who want to take care and provide for themselves and their families decide that when they don't feel well, they don't want to go to the doctor. I don't believe that's true at all. I believe that there's two subsets of men. There's a subset of men who've never had to go to the doctor, so they don't know where to start. They've never had to go. So they've never had a doctor. So now they're not feeling well. They feel like they have some prostate-related issues, and now they're trying to figure out where they go to get a doctor, and they want a good one. They don't know where to start. There's another set of men who have had a doctor, and they've had a bad experience. Have any of you ever called into a doctor's office to get an appointment, and then they tell you that the doctor that's been recommended to you by maybe a family or friend or someone else, they've recommended this doctor to you and they're not available for months, but Dr. So-and-so is available. And whoever that doctor is available tomorrow or maybe today. And you're like, yeah, absolutely. I don't feel well. I'm going to see him. But it never really occurs to you that why the heck is there a doctor at this place who don't have any patients right now, who was sitting there waiting for my call? It's because maybe they're new. Maybe they have the expertise that they need to be a doctor and they've done everything, but maybe they're new. And so what they have in expertise and medical knowledge, they don't have an experience and bedside manner. And bedside manner, the ability to talk to another grown man or to talk to a man about his problems when he doesn't feel well, when he is not at his best, is very important. Because, one, that man probably is not coming back if he has a bad experience with you. And two, he's not feeling well, so you get what you get. I was on the phone with one of my friends one time, and he was talking to me about changing his medications that he was going to see the doctor. So, man, I talked to this guy a couple times trying to get this changed. I'm going to go in there and tell him, that it's not working. And then I said, well, that's cool. Call me back when you, when you get out. Let me know how it go. And so when he called me back, I heard, I'm going to whoop your mother. And I was like, yo, who you talking to? He said, this damn doctor. He said, I'm tired of him talking to me like I'm a child. And I was sitting there thinking like, hey, man, y'all need to be on the same page. Like y'all need to be on the same page. But at the same time, I'm not in the position to tell that man that somebody, whomever his doctor was, didn't talk to him like as a child, because I've been through that. I've been through somebody coming in telling me what it is I was going to do and how it is I should do it. And I'm like, hold up, man. I don't know any of those medical terms or any of the stuff that you're talking about, but I know my body. And I could tell you that we need to have a discussion about, one, what's wrong with me. Then two, tell me what we're going to do about it. And then three, tell me whether or not it's still going to allow me to do what it is I want to do when I want to do it. Because, see, that's important to men. Doing what it is that you want to do when you want to do it as a man. But like I said, most men don't know where to start. So I'm going to share a little bit about where it is that I would start if I were you. And hopefully this will help you at least get to a point where you're starting. Now, one of the things that if you go out and look, right, they'll tell you to look at the 10 best in whatever area. So the 10 best urologists or the 10 best primary care physicians in your area. It is a great starting point, right? Because you can use those names to get references and determine and look at reviews and determine whether or not that doctor is at least somebody you want to consider. However, I also want you to consider and know that you can pay to get on that list. And because you can pay to get on that list, it's not necessarily that you are the best doctor. You might have most patients. You may actually have the biggest budget. Whatever the case may be, you want to make sure that you are using that as a reference point, but not the only one. Now, most of the literature tells you to ask a friend. I'm going to tell you to be a little cautious with that. And when I say a little cautious, I don't mean that you can't ask your friends. I'm just telling you that most of your friends may or may not have a doctor. They just may or may not have a doctor. I mean, it just kind of goes like that. So I want to make sure that you are aware that if you are talking to them and that you are getting a recommendation for them, that you ask them some additional questions. In the same way that you would ask them if you were asking them about a mechanic to fix your car. Ask them some things in regards to, they would tell you the price or whether or not they're good or how quickly they turn it around. Ask those types of questions about the doctor that they're recommending. And then ask them how often they go see them. If they don't go see them that often, then it's no way that they can give you that recommendation. And again, you don't want to go in there and have a bad experience. And you're going through something that may or may not be something serious. So, that is a terrible situation to be in if that person's not going all the time. Now, I would always say ask a woman. They go to the doctor way more than us. They have access to these types of things in regards to asking their doctor for who the best person is. And I'm all for that. I'm all for making sure that, you have someone that can assist you in that way. And so I'm like, look, ask a woman, a female, a family member, a coworker, ask them some questions in regards to that. Ask them about the doctors. At least we know they go consistently, and so we can have an idea. But again, we are doing an apples to oranges comparison. Because women go to the doctor so much, the way that they treat men in the doctor's offices sometimes, the same way they treat women, they're going to buy a car, or they're going to the mechanic. They talk to us as if we're just a mere convenience for whatever it is our insurance brings. I know I'm not the only one that's ever felt that way, where we're sitting in there and we're having a conversation and we're like, look, I read that we should have an MRI. Well, I don't know if I want to do an MRI right now. Okay, so what do you want to do right now? Well, I think we should just wait and then we'll do a test in 3 months. No, we're not. No, we're not. I'm not sitting for 3 months with this. No, I'm not. So what I always say is ask a nurse. Like, if you have access to a nurse, ask a nurse. Because they're in the medical field, they have an idea of who's best at what it is that they do. They also field the complaints and they understand when somebody has had a bad experience with a doctor. And so they will be honest, and they also have a better avenue to find out who it is you should ask or who they should ask in order to find out who the best person is for you. Now, you take all of that into account. Maybe you still have a bad experience with the doctor. All right, you have a bad experience. You're like, I'm not going back over there. I don't want to see him anymore. So you're like, I want to pick a new doctor. Well, I'm going to tell you something, and hopefully you all know what this term practice means. But if you do not know what this term practice means, I want to make sure that you are clear on what it means. If you go see Dr. H, and Dr. H is in this key practice, right? And you have a bad experience with Dr. H. Let's say, for instance, he's not trying to give you your MRI. So you decide you want to go see a new doctor, and you decide you're going to find one. And all of a sudden, Dr. K is over here. And Dr. K has availability, so you're going to go see Dr. K. Well, if Dr. K and Dr. H are both in the key practice, maybe wasting your time. Now, it's not all of the time. But us guys don't always know and think about that in terms of that. You're like, this is a different doctor over here. Same umbrella. So you go over there. The first thing that Dr. K is going to do is look at Dr. H and say, what is it that he did? What is it that he said? What are those notes? And then he's going to come with some preconceived notion in regards to that, because he has to decide, whether or not in this key practice he wants to go against what Dr. H has already said was the protocol or whatever it is, the procedure that he was going to go through with your care. And that takes courage, but they don't always do that. If you're going to go to a doctor and get a secondary opinion, make sure they're in a different practice. Make sure they are 100% in whatever other, not in the key practice, so that you can get a full secondary opinion. Guys, though, going to the doctor is work. You got to take off from work. It's going to cost you some money to go to the doctor, but it's well worth it. I don't like the stigma of men don't like to go to the doctor. I think that we need to teach each other how to go to the doctor and how to pick a doctor and what the best circumstance is for finding a good doctor, and then also what to do when your doctor's terrible. I always say that, we'll just continue to kind of grin and bear it when we have an experience with a doctor, because we're like, well, he already knows what's wrong with me. No. Don't do that with prostate cancer. Again, if they have not done enough of these surgeries, if they have not figured out enough about radiation, if they are brand new, I'm saying that they probably know what they're doing. But how many times they have done it would be important to us men in any other situation. Do not skimp on that when it comes to the doctors. Now, I hope this finds you well. In the comments, please add anything that you've done or any experiences that you've had with doctors that have not gone so well or those that have gone well. We want to make sure that maybe we have some practices that we know that we could send people to. And that is very important. I'm 100% for that. But I'm not on board with making sure that, that doctors who are continuously doing a poor job are continuously getting patients because of name recognition. That's absolutely terrible, and we need to start looking out for each other. So I hope this finds you well. Peace and blessings, fellas.